The coronavirus is spreading rapidly. With over 130,000 infected cases in more than 110 countries, the World Health Organization finally made the official designation many had been fearing for months.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
In Africa, there are now more than 100 cases in about 11 countries, according to the World Health Organization, including at least 2 in Nigeria. Health officials there are intensifying efforts to prevent more infections.
They have what it takes in terms of human resources, in terms of equipment. You see that we have.
Nigeria is one of only 3 African countries capable of testing for the coronavirus in real time. Part of Nigeria's readiness also includes upgrading testing labs, screenings, and public awareness campaigns.
At the points of entry, we have mounted a lot of activities. Enlightening people, checking people, getting information from them, and then at the same time comparing whatever information we are getting with what they are saying. Because a lot of people tell lies.
Other countries like Zimbabwe say, having learned from previous cholera outbreaks, they are ready to tackle the virus despite a struggling healthcare sector.
We are making sure that there is no COVID-19 entering through the borders of Zimbabwe.
But Norman Matara says Wilkins Hospital has Zimbabwe's only quarantined facility and lacks the equipment to deal with a serious outbreak.
There are a lot of gaps in terms of our health sector and the way that they have responded actually to this global pandemic.
Elsewhere, Tanzania is considered to be at high risk of importing the coronavirus because of its trade relationship with China. Health authorities are on high alert.
We have employed 100 more staff in the port of entries, and we have built their capacity to be able to detect the cases.
Tanzania's health ministry says they have 140 thermal scanners set up in all ports of entry.
Firstly, we have modern equipment, as you can see, but also we have a modern ambulance for sending patients to hospitals, and the number of our professionals has doubled to make sure we fight this.
Tanzanian doctors are urging the public to take basic precautions.
Make sure you wash your hands with soap, and if someone has a cough, they should cover their mouth.
And because of the virus's potential for infecting a large number of people, experts say countries should consider social distancing.
I think even countries where it still isn't a full-blown crisis might have to consider enforced social distancing. So in Liberia, we tried to quarantine and it didn't work out, but we enforced a curfew. We shut down schools. Government shut down except for essential workers.
That, he said, helped slow down the transmission rates. Mariama Diallo, VOA News.